Heart disease is, in fact, the #1 killer in America, killing more than 600,000 people nationwide. So we're taking action this morning to help. And Dr. Todd Hurst, a Mayo Clinic cardiologist, is here to discuss some of the things that maybe you should look out for, some of the things that you should know. And Dr. Hurst, first off, thanks for waking up and thanks for being here this morning.
My pleasure.
What a very important topic to discuss. And I know you guys at the Mayo Clinic are extremely busy with this kind of an issue. What are really the telltale signs leading up to a heart attack we should be aware of?
Yeah, great question. As you alluded to, heart disease is the #1 cause of death. About 1,000 people a day in the United States die suddenly, and most of the time from heart attacks. About 25% of the time, somebody's first sign that they have heart disease is that they die suddenly. So really emphasizes the importance of prevention.
What's something that people can do now, even if especially if it runs in the family, if it's hereditary, what do they need to look out for if they haven't been checked out by a doctor?
Yeah, about 85 or 90% of young people who die from heart disease have at least one of the major heart risk factors.
Oh.
So diabetes, high blood pressure, cholesterol, family history, or smoking are the major risk factors. So anybody with those factors should be assessed by their doctor and look for ways to minimize their risk.
Let's talk about diet, exercise, and just overall health, especially weight. What are the keys, maybe in order of importance to you?
Yeah, a handful of very simple, common sense things can markedly decrease the risk of heart disease. Smoking's probably the most important one. If you smoke, quit. I mean, and it's never too late. Even a year later, people may have the same risk from smoking as people that never smoked. So even if you're later in life, quitting smoking is really important. And then after that, I think it's being regularly active and eating a healthy diet being very important.
I think many people forget that the heart is a muscle, so you need to exercise it, correct?
Absolutely, absolutely. It's the fountain of youth, and you don't have to run marathons to get that benefit. Just getting up off the couch and walking is a great way to get started.
Is there one big mistake as we wrap up here you see people make, whether it's a patient or just something maybe you've read in your expertise?
Yeah, in starting an exercise program, I think people get too ambitious and they go too hard right off the bat. Either they get injured or they hate it. Start slow, work your way up to it, get in shape, and it's one of the best things you can do for your health and preventing heart disease.
Dr. Todd Hurst with the Mayo Clinic, cardiologist, I really can't thank you for your time. We could sit here and talk all day long and help our viewers, but it is important for people to know that ABC15 is teaming up with Mayo Clinic to bring you monthly tips to keep you heart healthy. Now, to get our Rally for Red reminders on the 15th of every month, sign up at abc15.com/rally for red. And